Friends and family, what's up? Justin Haushin, Epicenter Wellness. In today's video, which is part one of a two-part series, I'm going to feature some additional self-care exercises for the arms, specifically for the anterior compartment of the forearm or the flexor compartment, the yin channels of the arm, if you are familiar with that terminology. Uh, these videos will be a follow-up to my previous video, which featured an energizing exercise, specifically a rotatives exercise at the elbow joint to energize the muscles of the forearm and arm. So I suggest you check that out in our archives. Okay, well, we'll get to it. So some preliminary concepts. So I'm going to be using some technical terms, proximal and distal. So for the purposes of this video, when I say proximal, that means up toward the head or up toward the shoulder. And when I say distal, that means down toward the fingertips. When I say lateral, that means toward the outside of the body or toward the thumb side of the forearm, while medial means toward the midline of the body or toward the pinky side of the forearm. Front means the palmar side of the forearm, or like I said before, the flexor compartment, while the back means the extensor compartment of the forearm. So this is all with reference to standard Western anatomical position. Okay, so forearms, without realizing it, insidiously as days and months and years pass, given our work duties, our lifestyle habits, uh, tension and stiffness can develop here, which can cause pain locally. It can be connected to pain in the medial elbow, golfer's elbow, or medial epicondylitis, tennis elbow, lateral epicondylitis, trigger finger, numbness or tingling in the hands that may be diagnosed as carpal tunnel syndrome. All these problems can have as a component um, persistent tension holding patterns in the forearm. So self-care, self-love, preventive wellness all makes sense. As best we can, let's try to prevent problems, then manage a problem once it's manifest. Okay, so with my left hand, I'm going to call this the applying hand. My right will be on the receiving end, so we're going to call that the receiving forearm. So we're going to start out with some simple warm-up techniques. So I'm going to start from the elbow, make a few circles, and I'm using this simple gliding technique. So I'm applying a mild pressure, and I can feel as I apply this mild pressure, there's a little bit of friction that's generated, a little bit of warmth, and I'm working my way distally down toward the wrist crease. Anywhere from 3 to 10 circles in one place before you move up or down, that's appropriate. Very general guideline. And now I'm working my way back up proximal, back up to the elbow. Yeah. So gliding, it's therapeutic in a sense that the receiving arm is receiving compassionate contact. It's already relaxing some tension. It's already improving blood flow locally. But it's also diagnostic in the sense that as you do this, you will feel where the tissues might be a little gummy, a little tight, and that's good information for you to know. Another possibility, you want to switch it up, you can use the back of the hand, so your applying hand like so. Just a way for the applying hand and the connected forearm and arm to not get fatigued doing the same thing over and over. Now, this warm-up phase doesn't have to be super long. I mean, anywhere from, very roughly speaking, 30 to 90 seconds. I mean, it feels good. Keep going with it. You can even use this as a surface too. Okay. Now in the forearm, we have the three yin channels, according to acupuncture channel theory. We have the lung, which is on the thumb side of the forearm. So technically speaking, on the lateral side of the biceps tendon, you follow that down to at the base of the thumb. That's your lung channel. Pericardium from the just inside, just medial to the biceps tendon here at the elbow, and you follow that down to the middle of the wrist crease. And then the heart channel, which is very roughly speaking from the medial epicondyle, or this inner arm bone, and you follow that down to the pinky side of the crease. Okay, so we'll be systematic. Now, do you have to do it this way each and every time? No, but for the purposes of today's video, we'll use it just so we can cover all our bases. So I'm using my thumb, and I'm switching. This is not gliding. I'm applying contact, and then I'm maintaining that contact while applying a circular motion, and I'm pressing it a little deeper so that I start to cross fiber. It's like I'm plucking the tight, ropey muscles. And as you do this, you'll note some spots where it feels kind of tight, tender. So here, as I'm in the middle third of the forearm, I can feel right there, kind of tight. Now your pressure should be moderate-ish. You're not going too strong, at least not at this point. Now as I get down here closer to the wrist crease, it feels a little more nervy. It's like buzzy fuzzy going into the thumb belly. So here you want to just ease up on your pressure a little bit. Okay, now I'm going to go back up to the elbow crease, and I'm going to do the pericardium line, which is more or less the middle of the forearm. At this point, it doesn't matter a whole lot if you're going clockwise or counterclockwise. I mean, you're just giving the tissues here, the muscles, some love and attention, and right now that's good enough. So I do this for a living. So there's a certain level of stamina I have in my hands. If you're not used to this, you may find that your thumb starts to get fatigued. So one thing you could do about that is to make sure that everything is working together here and you're not overusing this muscle. So just like on the thumb channel, right in the middle of the forearm, the middle third, yeah, tight, achy, sore. It's like good hurt when I press into it. You can also use this knuckle right here, okay, as your contact point, just to switch it up and give the thumb muscle some rest. So here, as I approach the wrist, the distal third of the forearm, it starts to get a little buzzy, fuzzy, nervy, and I feel that in my fingers. Not necessarily a bad thing. Just you want to take it a little easier there. Okay. Now coming up to the heart channel, so now I'm on the pinky side or the medial side of the forearm. And yeah, these muscles here. Yeah, treating medial elbow pain, golfer's elbow. Very frequently, these muscle bellies are affected. So here, feels a little tight, a little achy. Now, as you're doing this on your own, where you feel it's tight and achy, and it's like that good kind of hurt, you can spend a little extra time there. Getting down toward the wrist crease. Yeah, a little buzzy, fuzzy. So I'm easing up the pressure a little bit. All right. Now, I'm going to go back up to the lung channel, and I'm going to press a little more deeply. So it's like I'm investigating. It's like an investigating hand, and then also like treating. So I'm applying an oppositional technique here. So as my thumb cross fibers, I'm actually rotating my forearm in and out just to get a little extra action there. Okay, so here, yeah, this is the lung 6 acupuncture point, tight. So I'm going to spend a little extra time. You don't want to overwork the dough. I mean, generally speaking, 5 to 10 deeper passes, and then move a thumb breadth over. Okay, going to be focusing mainly on like the proximal 2/3. Now I'm on the pericardium line. And obviously when you're practicing on your own, you want to do both sides evenly. Okay, I'm actually going to switch to this as the contact point. If this kind of self-care really speaks to you, you maybe want to invest in a simple like massage instrument. Yeah, so right here, ooh, that's tight. Feels good though. Yeah, so maybe your job involves you sitting at a computer for hours on end, very little movement variability. Maybe you operate machinery with a lot of repetitive movements of the hand and arm. This can favor the development of tightness and inflammation and pain. Actually, I had a patient just a few days ago. He was complaining about how his forearms were so tense. By the way, I'm now up on the heart channel. His forearms are so tense. It's related to his gym workouts. I mean, you got your forearm curls, biceps curls, and then combined, if you're sitting at the desk for hours a day without any uh, stretching or energizing exercises to balance it out, that can create a little trouble there. So just distal to the medial epicondyle, this bony projection at the distal end of the humerus, yeah, that feels a little tight, a little achy. So I'm in there with a little pressure. I wouldn't call this severe, strong pressure, but it's like moderate to strong pressure. Okay. Check in with your spine, check in with your shoulders. Make sure everything is upright and relaxed. Okay, and now here at about the junction of the proximal 2/3 and distal third of the forearm, yeah, kind of tight in there, a little buzzy, a little nervy, so I'm not going to get in there too much. Now at about the distal third of the forearm, there's a deep muscle that runs crosswise. Pronator quadratus, I believe, is a name, but I'm not 100% sure, but it's a deep muscle here. And so I'm just applying just some deep, direct pressure. And yeah, there's that little muscle ache right there. So right now I'm on the lung line. So the two thick tendons in the middle of the forearm, lateral to that. My job involves a lot of manual therapy. So a lot of hand, forearm, wrist use. Checking the heart line, not too bad. More buzzy than dull, achy. Now on the pericardium line, between these two thick tendons, yeah, it's a little achy in there. So I'm just going to get in there with some deeper pressure and cross fiber that a few times. Okay, and then you can end the whole session with just a little bit of round rubbing and maybe like up and down stroking like that. Okay, so you want to do both sides. After I end this video, I'm going to wind up doing my left side just to balance it out. I hope you found this helpful. In the next video, I will be working on the yang channels, so stay tuned for that. If the spirit moves you, share it with a friend who you think might benefit from this, and hit the like and subscribe button, help the channel to grow. Leave a constructive comment, and I'll see you down the road. Take care.